Today, we have with us Dr. Vidhya Nair. She's a psychologist and holistic healer. She's also a certified hypnotherapist and has expertise in healing anxiety, depression, anger management, identity issues, and phobia. She has been counseling cancer patients for the last 2 years. Her therapy helps in healing cancer and getting them over worries that are pulling them down. Empowers them to fight cancer stronger. She believes that it's important to decondition and recondition ourselves for a better mental health. So, welcome, Dr. Vidya Nair, in today's Healing Center Talks. Yeah,
Hello, Dimple. Hi. Good evening to all who are here. I believe someone's mic is on, so I would like everyone else to mute themselves so that there's no disturbance for others. Yes? Is everyone on mute?
yeah,
I couldn't hear you clearly while you were talking.
okay.
Yes. Hello, everyone. As Dimple introduced me, I am a psychologist. I am a holistic doctor. So in my career, I started as an MBBS doctor. And while I was practicing as an MBBS doctor, I had a lot of realizations in my practice about healthcare, about how people look at healing, and how it is a very, narrowed perspective towards healing. Yes. Thank you so much for muting your mics. Yes. So in that journey is when I realized the importance of the mind in this process of healing. And I've always been keen on understanding behavior, human behavior, that my curiosity has always taken me there. It's only when I started working as a doctor, I was mostly in intensive care. And during this time in intensive care, I saw a lot of what you call as miracles happening around me. Because as doctors, we measure it otherwise and we would look at it otherwise, right? And that's when I realized that I need to look into it more and change my approach towards healing a little bit compared to this narrow perspective of just looking at it from the perspective of only the physical science and not the other perspective, that is the mental science that we need to look at, the psychological, the emotional aspects of healing that we need to consider as well in this process of healing. Yes. And that is when I got on this journey of studying. Yes, go ahead.
I think something is not right. Maybe it's your mic or something, because not able to hear you clearly. It's
Let me just
different than
check.
the usual one.
1 second, please. Let me just check on mine. I'm sorry about that. Is it clearer or not very clear for you? I might just disconnect my earphones then. Hold on.
Yeah, some echo is there. Atul is saying audio not clear. Some kind of echo is coming.
Now can you hear me clearly?
Oh, yes. Very different. Okay.
Thank you. Yes, I disconnected my earpiece. So yes, that is a brief description about what I do. I do use a very holistic approach towards healing. My education has taught me the biological aspect of healing, and then the psychology part has taught me the emotional and mental well-being required in the process of healing. And I inculcate both, the study of the mind and the body in the process of healing for my clients.
Okay, great. So, how did you come to the field of cancer?
So when I started working, as I said, I was in intensive care. And more than that, I've had incidents in my life where when I was young, I had a cousin, I was very young back then, and she was diagnosed with a very rare disease back then. It was called scleroderma. And I was a curious biology student, so I was always questioning about even when she got diagnosed with it, how it happened, what happened, and all of these things. And a part of me always questioned it from a different perspective, in the sense that because I knew how she struggled mentally, I know she had a lot of struggles in her life at the personal front. I understood her burdens that she was carrying, and somewhere I questioned, has that got anything to do with what she's going through? I did have a question then, but obviously being a biology student, I was like, that doesn't make sense, and I was a kid then. So I was like, that doesn't make sense. How can that be? How can something emotional show in your body? How can something, when someone's not going through a good mental health, show in my body. I didn't have that awareness back then as a child, as I was maybe like 7th or 8th or something like that. Then after that, after my MBBS, I had another relative, a very close relative, who was diagnosed with cancer. And when he was diagnosed with cancer, and I knew about their conditions, family conditions as well, I understood that there has to do something with the environment that the individual is going through, that what is going on in their mind, their emotional space somewhere. Because even when we study about cancer and as a medical student, we do know that, yes, of course, there's predisposing conditions. There are some prerequisites. There are prerequisite factors like genetics and all of these things that do come into picture. But none of the studies tell us that it is the reason that the cancer develops. It is not definite. It is a maybe, that maybe it is this, or this. Yes. And then, of course, I studied more about it. And when I studied more about it, I came onto the field of epigenetics, which is recent, this field of epigenetics, which came about in the 1990s, and where it talks about that genetic is not all. Right? For a long time, we've always been talking about genes being responsible for everything, our genetics being responsible for everything that happens in our body. But we also know that individuals who have cancerous genes not having developed cancer, right? We've all seen that not all people who have the genes develop cancer or conditions requisite to that gene. So that's where epigenetic came into picture, where scientists have found out that there's environmental triggers and signals that stimulate these genes and trigger them and activate them. That's how the genes become active. Right? So that environmental stimulus is needed for this. And, I got more and more. I will be talking more about it in this session. But yes, that's how somewhere I understood both the aspects of the biological factor as well as the environmental factor playing a role in this field of cancer. I'm sorry, I cannot hear you. You're on mute, darling.
So when we talk about cancer patients and when they are diagnosed, when you hear it first time in your family, somebody is having it, nobody's prepared to deal with such situations, and it comes all of a sudden. You don't know what to do, where to go. You hear from anybody and everybody, whoever comes as a well-wisher. And though even if the medical treatment is set, even if you know now medically what needs to be done, there's a lot of things needs to be done on the mental, emotional, and the complementary point of view as well. And like just before Healing Circle, I was talking to somebody and she said, yeah, I come from the doctor's family. My father has been diagnosed and we have started the medical treatment, but that's not it. I am still not content. I'm still, looking for more options. And and then she was asking me about how we as a family get the consultation, because okay, fine, financially maybe yes, there are certain ways you can help us, but then even when that is sorted, still something more I'm looking for. And then when I was talking to her, kind of understood what she's going through, because just 2-3 weeks back her father has been diagnosed as advanced stage cancer. So she was asking for any counseling or anything that will help her mother, her father, and the entire family, because she was like, a lot is going on and nobody's happy. Of course, they will not be happy, but nobody's even, there's always stress, anxiety, fear, and all of those things coming into place. And we want him to behave in this way, but he is not behaving in this way. He is behaving in the other way. Like, yeah, that's pretty normal. It's the caregiver-patient tussle, which happens always. So what will be your metrics, or what you want to say to those families who in the families where somebody has been diagnosed with cancer recently?
Yes, very rightly put. Not just the person who's diagnosed with the cancer, but also the caregivers are in a tussle, in the sense of not mentally ready, first of all, to deal with that situation. Because when we are put in that situation, it's like hitting a wall, because you're not prepared for it, first of all. And mentally, it's a big turmoil, because suddenly you're facing something you're not equipped with to face. You don't know what to do about. And again, there's all the information and knowledge that you get about it is not enough, because it's all very negative that you hear mostly when you hear about it. So for a family who's dealing with it, I understand that all that you're hearing might not be in your favor, and all that you're seeing might not be in your favor right now. But, accepting that situation is the first thing that we have to do. And that is very tough for anyone who goes through, because knowing how I've seen my family, go through this. And is there audio problem still? I'm so sorry. I'm not sure what.
Here, but I think somebody is mentioning there's an audio problem. But I can hear very well.
Clear for everyone else?
Yeah. Mehul, can you hear? Yeah, you can hear.
All right.
Yeah.
So during this situation, the first step for everyone in the family, because it's a shock state that you're put into first, is just sit down and first just accept it and talk about it amongst yourself as well, right? Because first few things, normally in Indian families, what happens is once someone comes to know about something which is so dangerous, they kind of shush it either. Or, like for example, if the child is diagnosed with it, the parents are like, no, don't tell him, or don't tell anyone else. And now there is a lot of confusion amongst the family members. Either of them don't know how to behave, and neither of them don't know what is the reason each of them is behaving a certain way, right? Just like you said, the parents, expect the child maybe to behave a certain way, be more responsible, because they're upset that the child is going through something like this. Now, the child has his own problems. Now, if you only communicate about it, is when you can both of you all understand that both of you all are in a vulnerable state. And that's okay. And that really helps to take on the challenges which are coming ahead. But most of the times, it's a lot of miscommunication that happens during the situation. And that's not needed in such a situation. Most importantly, what you need is a lot of trust amongst yourself, a lot of love and compassion, a lot of support within your family to deal with the situation together and not divided, right? Because when you're together in this process to deal with it, each of you all can somewhere be there for each other and support each other well. Yes, so the tussle can reduce if you communicate about it, however difficult it may be. I know it is difficult, and that is the reason a lot of us avoid it. A lot of us feel like we'll do it tomorrow or later, and just hide into their cocoons and deal with it by themselves. And what happens is each one is now in their cocoon and trying to deal with it by themselves, which is more difficult. But if you actually communicated with each other, it might be easier to understand and be there for each other. And for counseling purposes, yes, I do believe that if I are in a situation, if you're finding it difficult to talk to each other or talk to anyone even close to you, please do seek professional help, because sometimes we're scared of judgment to show our vulnerability, and that's one of the reasons. Like, for example, fatherly figures. Fatherly figures are very strong and independent, and they have this role model that they have to play, and they don't show their vulnerability, and they might be going through a lot of mental stress or emotional burden or baggage that they're carrying and feeling not in control of themselves, but they don't show it, and that might take a toll on you even physically. Yes, because that's not needed in your process of healing. So seeking for help is a very important step here if you're unable to do it amongst yourself. So I think that is one of the most important stuff which should be inculcated in any therapy, in treatment of cancer.
Right. And can you share some of the tips which can help patient separately and then caregiver separately to strengthen their bond, especially when they are going through the situation? Like, I was again talking to a patient yesterday.
Mm-hmm.
The first time we talked, and we kept on talking for like 1.5 to 2 hours at midnight.
Mm-hmm.
And then he shared lots of things what he's doing for his mother. So the mother was living in the joint family before, so he took her away from the family so that she can focus on herself, because usually moms want to be doing everything for everyone. Mm-hmm. So they started treatment some other state, some other city, and he is ensuring that though if he says, okay mom, you need to drink this, and if at that time she is not drinking it, she will drink it after 4 hours, 5 hours, तो वो 4-5 घंटे तक the son is in stress कि अरे, और फिर वो relation भी खराब हो रही है कि आपने push कर रहे हो, and then she is not in mood to have it at that time. So he was like, I've been doing certain things such as अगर उन्होंने पी लिया है, अगर दवाई ले ली है, तो he will leave a sticky note with smiley there. अगर नहीं पिया है, तो he will leave the sad note there. And be like, okay mom, let's write something together. If you want to share, you share with me. Otherwise, keep it with you. But let's write something together. Or if mom says that, okay, I want to do satsang, okay, let's do it right now. So giving her freedom at the same time, when she doesn't follow a few things like medicine and all, then there's a tussle. So now he is trying his best. I mean, the best to ensure that mom recovers, because some of the doctors has given up, but I still see a lot of hope in her recovery and she can recover for sure. And he also sees the same. So some of the tips which you think can help patient caregiver both to strengthen their relation in the situation when they are going through it together.
Absolutely. So one thing that you mentioned about when he's trying to tell his mother to take medicines or water, whatever, drink something, and she doesn't, and then he goes through like for 3-4 hours an emotional turmoil. Now, for the caregivers, most of the time the caregivers are working from a space of unconditional love. Yes, towards them, absolutely, because suddenly when someone you love is you get to know is going through something difficult and is in a difficult situation, you tend to take on the full responsibility of that person. You're like, no, now I'm going to take care of everything. Just like you mentioned that he took his mother away from that space and said that now I'm going to take care of her. Right? I understand. But at this situation, what happens is we try to control everything now, because we think that they might not be able to, and we need to do everything for them, and I understand that. But at the same time, a little bit of freedom, which you as mentioned, is needed. So in this space, what you can understand, try to help you can try to help yourself is when she doesn't listen. For example, if you told her to have a glass of milk and she doesn't listen at that point of time, just take a moment and pause and look at yourself and ask yourself, what is it that is making me so frustrated and angry right now? Right? Because I'm trying to control her somewhere, but there might be a reason that she's not drinking it right now. Yes. So keep a delay, a moment for yourself and tell yourself, okay, you know what? I'm going to check after it after 4 hours. So now what am I doing to my thoughts is I'm giving it an answer. I'm giving it like a solution. That because otherwise my thoughts will keep going. Did she drink it? Did she not drink it? Is she going to drink it? What will happen if she doesn't drink it? My thoughts will keep going and going on and on and on, right? I'll go into that loop. So now I'll just keep a system like, okay, I'll ask her once and then I'll ask her after 3 hours. So a system can be, given to your mind to pacify your mind that, okay, I'll check after 3 to 4 hours. At the same time, it's, someone who's going through something difficult may not be in the mental state to sometimes feel good about anything and maybe really feeling really, really low. In a situation, I might not be able to do few things that are told by the doctor, being thinking that, they almost reach a hopeless outlook sometimes, knowing that they're going through such a, dangerous condition, which is very, very serious and makes them go through all those kind of patterns of thinking. Now, you have to try and understand that sometimes they might not feel like doing things because they feel like, what's the point, and have a hopeless outlook. So in this situation now, just instead of pressurizing the patient and telling them, no, you need to do this or you wouldn't have this and all of these things, just let them be for a while. And after a while, ask them, maybe tell them to do something which helps them feel more active or happy or joyful, right? Some activities like that. So for example, because energy stores in us in some way or the other, right? Suppressed emotions, that is sadness, resentment, frustration, all of these emotions store in us in some way or the other. So during this time now, what you can do, both of you can involve yourself in some activity instead. So if you've noticed that she's not being herself, or she's not listening, or she's not doing the same thing as she was doing yesterday, there might be a reason behind that. Maybe you don't know what it is. That's okay. Maybe you're not willing to talk about it. Maybe she's not willing to talk about it. Okay. Give each other the time and space to take a pause for that. But involve yourself in some activity where you can increase your bond somewhere, and both of you all can have a mutual understanding that, okay, for now I've kept this task aside and we're having fun. So, for example, activities like listening to music, sketching, drawing, dancing, walking, all of these activities release this energy some way. So now what's happened is, if she is in a low mental state, right, like emotionally, if she's in a low state, that is released somewhere. And then that, those endorphins which come out of your body will make you feel motivated to do more. Yes. Because that is what we don't understand. Normally, we just look at the behavior. We don't try to understand the emotions behind it, maybe the thought process behind it. Might be difficult. So now individually, what you can do to understand your thoughts is journaling. Now, this is very, very helpful in both the cases, the patient and the caregiver. As I said, when a caregiver gets into a situation of taking care of someone, they tend to neglect themselves as well. and they don't understand the importance of themselves being healthy as well in this process of giving care to someone else, right? So it's very important for you also to understand your thoughts and understand your emotional state. So for this process, both the caregiver and the individual, the patient, both of them can understand their thoughts better if they start journaling it whenever there is an emotional turmoil. And most of the time when we start writing, we feel like, someone will read it, or someone will judge it, or even you judge it at times, thinking that, I shouldn't feel this way, or I shouldn't be talking this way, but that's okay. It'll help you get clarity. So journaling really, really helps in understanding your thoughts, and then only can you work on it. So going to the thought level is very important at this basis. And activities, of course, as I mentioned, involving each other in activities which has got nothing to do with your treatment, has got nothing to do with your medicines, and just for a few moments, forget about the cancer, forget about the illness, forget about the situation that you're in, allows you to have those moments of joy with each other, which will help us, keep it healthy rather than keep it frustrated that he's not listening, and or the patient feeling, I'm feeling too pressurized by my son to do things, and then feeling instigated at times. So that helps a lot.
Got it. Great. That is really helpful. And some of the things what I always share with patients when they are newly diagnosed, that of course it comes with the shock. So it's important that we deal with that first. And if it's non-emergency situation, then all those non-emergency decisions can be taken later. So first, just absorb what has just happened, and then eat good food, a good lifestyle, and talk to people, and then gradually plan how you want to take it forward from here now. So as the shock wears off, begin to think about taking medical decisions, because medical decisions are irreversible. So whatever you are taking, deciding, it has to be accurate, because we cannot take any chance with that. And with the diagnosis, there can be pain as well. So it's important to address pain then and there, because otherwise you cannot think in a straight direction, and then we find a very uncomfortable situation when we are in pain. So we don't think about cancer, anything else. We just want to get rid of this pain right now. And then one of the mistake which people usually do is rushing into the treatment. So if it's not because when the moment they hear the word cancer, they feel like, or I would say we feel like we're running out of time, and it's spreading, and it's fast growing, aggressive, but it's not always the case. Right. So you always have a couple of days before you rush into any treatment. What treatment should I go for? Take multiple opinions, and then decide what is the exact course of treatment for you. So, and then many people also regret that they rushed into the treatment without fully understanding the choices that are available to them. And also, they are. You must be knowing with many people, they are anxious or they are in depression with the diagnosis. Yes. And so some of the things like meditation or exercise or prayer or walking into the nature, playing with the pet like Mehul is doing right now. So all of these things helps a lot.
Yes, absolutely. Oh yes, having a pet helps absolutely a lot. It's like a blessing in disguise to have a pet.
Definitely.
Yes, absolutely. As I said, and physical activity I have seen has shown wonders in this line of treatment, because as I mentioned, all of this energy gets stored somewhere in our body. When we don't talk about it, it is somewhere stored in our mind and body. So if you notice somewhere, you'll have muscle tension in your neck or shoulder, your jaw muscles, and all of these things. And when you involve yourself in physical activity, somewhere there's an outlet to let it out. And that's most important. And slowly and steadily, when you allow yourself to freely let out this emotional energy that you've collected, you can even start interacting in words with your people around you. And you get that confidence to do that. But we're so conditioned to suppress it, right? About anything, about even our normal emotions, we're not used to talking about it. But it's important. And very rightly said that, there's no need to rush into treatment. There's no need to be like, you have to act on it now because it sounds so dangerous. You have to think about it, and you have to think about what you want to do about it, not get overwhelmed with just the diagnosis, right? Because it happens. We get so overwhelmed with it that we tend to, and we're in a shock state. And normally in a shock state, our mind expects us to do something about it. You're like, no, we need to do something right now. And that tends to be hasty decisions at times. So discuss it with your family, do good research, right? And there's so many modalities of healing, right? Do research on it and make a decision for yourself.
Right.
Decision.
Yeah. And one of the things which we all can relate here is, when somebody is going through the treatment, now not the recently diagnosed, they already know about the treatment and the complementary treatment and all the healing choices available. Now you are taking the treatment and you are having side effects. And yes, because of the expensive treatment, you are in stress all the time. So, what would be your suggestion to take the stress away? And we all the time say be positive, but then it's really difficult to be positive during that time when you know that you are having very bad side effects, you are running out of money, and again the other person, your spouse or maybe the parent, they have to take care of you all the time. How can you be positive and happy at that time?
Yes. So yeah, I understand that during the situation when you're going through side effects and where you have all the negative aspects of this journey, healing journey, coming about you at this point of time, it gets very overwhelming, and sometimes you feel like just giving up. I understand. We all have seen situations, and I have seen situations with my clients during this time where they've gone through, going through chemotherapies and losing hair and not being able to face people. Now, during this time, all I would like each one of you to just focus on is that, yes, this is a part of this healing process and it is temporary. That is all you can tell yourself, that this is not in my control right now, and that's okay. Right? Because sometimes when things go out of our control, we feel like everything is going to go wrong and, this won't get better. But this is just a small part of the healing journey. It's not the entire picture. Yes, it's not the end. Yes, it is a part, it is a hurdle, it's a challenge in the way. And once you overcome this, you're going to see the better part of it, right? So during this time, I know it's very difficult to talk positive or see positive, but just accepting that, you know what, okay, this is not in my control right now, but all I can control is myself, and tell myself, I just need to get through this somewhere, and I'll get through this. And just keep reinforcing it to yourself, and even your loved ones, being like, however difficult it is, accepting that it is difficult and I'm having the worst time of my life, but I'm just going to take one baby step at a time and just keep going. And that's all I can do right now. Just keep going. That's it. And no other pressure of trying to be positive, no other pressure of trying to feel good about it, nothing. Just be like, okay, yes, this is not in my control, but I'm just going to take one step at a time and keep going. Yes, I'm not feeling good about it. It is a difficult time, but right now I'm just going to look at the end and hope I'll get there soon, and just keep going one step at a time. Because keeping a goal in mind, a picture in mind, actually motivates you to keep going, right? When we look at now and we this doesn't look good, we tend to feel like the end is not good. But if I have this goal, and normally with my clients, I have young clients with me, and I tell them, if you're losing hair, so I try to tell them, now what is the good thing out of this that you can do? What can you do of this situation? So I have a young student, she's a client, and she told me, okay, so I'm going to start wearing colorful wigs now. So I was like, okay, great. So would you have been doing that before? It's like, no, I wouldn't have, but I think I'm going to try wearing colorful wigs now. And it was very wonderful to see how positively she was taking it. But at the same time, she was not doing well. And I told her, okay, you know what? It's okay if you're not doing well right now. And it's okay if you're not able to deal with the situation. Sometimes we pressure ourselves so much to be fighters and to be always feeling good. That puts unnecessary pressure on ourselves and gets too much to handle. Right? But sometimes it's okay to say, I'm not doing okay. And but I'm just going to get through this. And that's it. Yes, it's all right to say that. Because that itself is very relieving. To finally not put on a brave face and say, okay, everything's not okay, but I'm putting on a brave face sometimes. It's okay to say that I'm not okay, but I'm going to get through this.
And what about when any doctor tells you that you have 6 months to live, which is not always true? Yes. So how do you handle such situations?
Yes, so from what I have studied, and I know this is the part which limits us in our thinking, when the doctor itself tells you that, you have 6 months to live now, we individuals, we don't have the knowledge as doctors. If a patient goes to a doctor, the doctor, according to them, has all the knowledge about this disease. And so we believe whatever they tell us. Yes, I understand that. I absolutely understand that. Of course, we've done studies and research. And according to the doctor's knowledge, the doctor has given us this timeline. Absolutely okay. But all I want each one of y'all who has been either told or know, or, if someone you know has been told this, you can tell them, yes, okay, that is the doctor is saying, but you also have an ability to think otherwise and not believe that. Yes. I know it's very difficult, and I know people will be like, how can that be? The doctor said it's 6 months. Yes. Now, this is where I would like to talk about something is our belief systems and how it affects our body, right? So we all have two programmings in our body. One is our healing programming. Now, healing is a natural programming in our body. Our body is naturally programmed to heal anything. So, for example, if we get a wound, even if we don't do anything and don't apply an ointment, it does heal by itself, right? So, our body has its own intelligence to heal anything and everything in the body. Yes, unless, of course, traumatic injuries like accidents is something where you need surgical interventions, of course. But most of the time, the body has its own intelligence of healing. Now, what happens is this healing mechanism of our body and this programming has been altered over the years because the new belief system has been developed for very, very, very long, since a very long time, that we've started depending on other things for healing and not. Is we've started believing that we need medications, we need that, this and that for everything to be okay, and all of these things, right? Of course, in some situations we do, but if that belief system were to change, for example, if I had put in a programming into my body saying that, yes, I can survive through this 6 months and maybe more. I know my body and my body will live more than 6 months. Now, this is the programming I have instilled into my mind. Now my body has to listen to it, because that is how the mind and body works if I instill this programming, and that has to be done repetitively because it has to reach a subconscious, and the subconscious mind is what controls you 90% of the time, right? So for example, let me tell you for how a subconscious act works. Like, so for example, how we learn driving is a learned behavior, right? Now when we learn to drive, first time we learn to drive, we're very conscious about everything, where the steering wheel is, where's the rear view mirror, where's where to look at, where's the accelerator, brake and clutch and everything. So very consciously, now we've gained this knowledge about this driving act. Now, every time I do it again and again and again, it becomes automatic after a point of time. And after months now, I don't even have to look. I just put in the keys and my car starts and my hand and legs are automatically moving. I can even talk to my friend and the driving act is done automatically now because it's become a subconscious programming in our mind, right? Now, this is how a subconscious programming works in our body, any programming. So if we can learn an act, a motor act, we can also learn beliefs and other programming that we can give ourselves, right? So now if I give my mind a programming that, okay, I can do this, I am enough, and I keep telling myself this, somewhere in my subconscious it will go and store. And unknowingly, because subconscious is not in our control, unconsciously your body will start acting according to that programming, and the cells also will start listening, because the signal sent from your nervous system to the cells is like, you know what, you need to act now. The signals from your mind will go to your cells like, you know what, you need to start working now. You need to start recovering and growing, and not being protective mechanism rather than growth, rather being growth mechanism. Because our body can either be in growth or protective mechanism. That's how our body works. Most of the time, when we hear danger, our body goes into protective mechanism. So protective mechanism is conservatory mechanism, in the sense that we start to try to do everything with this much shunted, inhibited space, like, try to protect or conserve everything that we have. We're trying to protect our body, right? So for example, when you get to know about a diagnosis or a disease, we go into protective mechanism, be like, okay, this is going to happen, this danger is going to happen, so I'm going to do everything to save myself from this danger. But if we change that to a growth mechanism, wherein I tell myself, okay, this has happened, but I can change this, I'm going to grow from this, I can learn from this, and change that perspective in my mind. Now I'm allowing myself and my cells, my brain is telling my cells, you know what, grow even in this environment now that we've developed. You need to grow even now. And now I'm giving, allowing and giving opportunities to myself to learn new things, to develop. And in the journey, it is a lot of things that each individual respectfully learns and develops in this process. So yes, all I would tell a person who's been told this is, you know what, I agree, your doctor has told you something, but you do have a choice to believe otherwise, and you do have a choice to believe in your body and your body's intelligence, and you can tap into it and you can access it. You can try to break free from this pattern, which may have developed from some other reason altogether, because science is ever growing, and I don't think this is the only knowledge that there is about cancer and all the illness. There is much, much, much more, and why not look into that perspective?
Right. Very well said. And we all experience it all the time.
Yes.
So there's one question which is coming to my mind right now is the power of attraction, which has been asked in the healing circle many times before as well. And I'm very curious to know this answer, that how the power of attraction works, that you are thinking something and then it happens with you, maybe immediately, maybe after a couple of years. So how does that happen?
Yes, it happened with me so many times. And this is from my personal experiences. I can tell you that it's only after I uncovered my limiting beliefs, right? Because again, as I said, in our society, we've been conditioned with a lot of limiting beliefs telling us that you can only do this, you can't do this, you can do this, you're a girl, you need to behave a certain way, or you are from this space, you can only think like this, you can only behave like this. Right, which limits our true nature. Now, if you look at humans, we are actually a part of a bigger environment, like a bigger source. Right, we're all a part of this whole ecosystem where there are plants, mountains, wind, water, everything, land, and all of these. We are all part of this. We are all one unit. And if you look at physics, if you look at quantum physics, right? Physics, quantum physics, and all sources of physics have said that there's no energy which is created nor destroyed, right? So if you think about it, the whole entire Earth is always in balance in the sense of equilibrium, maintaining that total amount of energy, whichever that is. For example, 100. I'm just saying, right? 100 is the energy that this entire Earth has. Now, there is neither created nor destroyed. Now, if you think about it, so we are part of that 100-watt source of energy, right? And each individual is a part of that. Now, if you think about it, then we do have a lot of energy within us, which is somewhat contributing to this universe, which we are part of it. If you think about it, like we don't think about it from that perspective because we look at the universe. Now, in the universe is the Earth. In the Earth is the humans, and the humans is me, one. Even if I am 0.0001% contributing to the universe, I'm still a contributor to the universe, right? So somewhere, if you think about, if you think from that perspective, I am the universe. Yes, I am a part of it. I'm contributing to it. Now, if I am, that means I do have a lot of energy which I don't know about. There's a lot of limitless potential inside of me which I'm unaware of it. Right? Because we don't look at us as individuals or humans from that perspective. This is a part of us which we can, if we start looking at, right, and tell ourselves, okay, if I am a part of the universe and if I have a source of energy within me, what is that source of energy? Do I know what kind of energy I have within me? Do I know my potential? Do I know who I am? And if I start looking at myself from that perspective of me having limitless potential, from me having that limitless energy and a source of energy which is a part of this universe, if I start looking at myself from that perspective and understanding that, and understanding my actions and thoughts contributing to this bigger consciousness or universe, whatever you call it, you start realizing how your actions are playing a role and attracting more. But for that, we have to break free from these limiting beliefs which says that, no, you can't do this, you are not capable of doing it, I am not enough, or I'm not smart enough, I'm not intelligent enough, it is not for me. All of these beliefs are negative beliefs which are not allowing us to actually access into our true potential. Right? But if I don't access my true potential, I'm not connecting to the universe. I'm not connecting to the true source, which I call, as I said, this is the source, right? And we are a part of that source. But once we start believing in ourselves, and that's the key word, belief is the key word here. Once we start believing in ourselves, that understanding that we also are contributors in some way, that our thoughts and emotions are some way contributing to this universe, and at the same time, this, whatever I have, this spirit, soul, whatever you may call it, this energy that I have within me is limitless and it has a lot of potential if I start believing in it. And then when I start believing in it and I start thinking, so I do visualizations in my meditations, and it's freaky at times when I started doing it. I have had things come my way, which is like surprisingly, I never tried before. It's only when I started doing it myself, people have started giving me books, people have started calling me up for opportunities. Like I would think about like, okay, I want to do something for something. And even this talk, for instance, I would think about I want to do this, and it would just be a thought that I'm sending out into the universe, and someone would approach me and be like, what, would you be interested in doing this talk? Right? But it's only because I thought it's possible when I send out that thought. When I thought that, I thought it's possible. It was not in a negative source that, will it be possible, or I can't do this, or I'm not capable. I thought that, okay, I want to do this, I'm going to do this. So it was a very positive statement that I sent out, a thought with a lot of belief in it. And that's when it starts coming, when you attract into yourself. Law of attraction only works. The key word in the law of attraction is belief.
Interesting. And I myself have experienced this many times. I was sharing in one of the previous healing circle that something I imagined 10 years back has happened with me 2 years back. So it happens, and I don't know how it happens, but yes. So when we know that it works, the power of attraction, law of attraction, or beliefs, or what we visualize, as well, we use it in the right direction, in the positive direction, to heal ourselves, to see what we want to achieve. So for cancer patients especially, we talk about self-healing. We talk about, I know many people personally who have healed themselves even from last stage cancer with medical treatment, without medical treatment, with healing like that. And then it's just wonderful the way it works. So all those people who are currently going through the treatment, going through the journey, my only request will be to all of you to focus on your inner self and then just talk to yourself. Yes, I can overcome this. I will be all right. I will be fine. Or just say, I am fine. It's okay. Just a phase which will pass on and everything is good. It's just a temporary phase where I have to take medicines, and like we all take fever medicine for 5 days, something. It's just like that. I have to take for 5 months and then I'm going to be fine. So it's not end of life. It's nothing like that. It's just a phase and we are going to go overcome this. So it works. And many of, and many of people have healed themselves with this thought of, self-healing. So,
because when you repeat it, what happens is when anything that you repeat to yourself now, because a lot of people, I tell people to do affirmations. Now, affirmations is similar. It's a simple, positive, present tense sentence like saying, I am enough, I can do this, I'm healthy, wealthy, alive, and all of these things. When anything that you repeat again and again and again, as I said about the driving also, it becomes a pattern, a subconscious act in your brain. It becomes a program eventually in your mind. And now, even when you're not knowing, your mind and body will work from that space because it's become a program in your mind. It becomes a part of your subconscious mind, right? And that is the reason it's so important to repeat it again and again. You might think, and as I said, believing in it makes it even more stronger to make it a part of your subconscious mind. Every time I say I am fine, even if it's for a second, saying like I am healthy, prosperous, alive, I can do this, and all of this, that second of belief will make it even more stronger to make it a program in your mind. And then eventually it becomes automatic. And then your cells are working from that space. Yes, because this is where your CPU is. This is where the program is. And this is where these signals are sent to your cells. And if you're interested, there are a lot of scientists who have worked along this, by the way. A lot of scientists who have worked along this line where they have used power of the mind in the sense of using visualizations, even the body in the sense of movement, or you alternating a movement from right side to left side. If your right side is not moving, your left side is used to use the right side of the brain, and use the neuroplasticity of the brain to help rewire the brain. And that's possible, by the way, rewiring your brain. And for a long time, a lot of us have thought that, our brain is hardwired and that, it only works a particular way. No, you can change that. But it's again through repetition and patterns. Because there's this scientist called Norman Duhigg. He's written books on it. So he's collected stories from various neuroplasticians. There are 2 books. There's one is Brain's Way of Healing and The Brain That Changes Itself. The first book, that is The Brain That Changes Itself, talks about, how the brain can be rewired. So one of the ways, as I said, is by repetitions, visualization, writing things multiple times. Again, we're just rewiring the path, the neural path, that is the circuit. If you think about it as a circuit which is hardwired into your brain, it can be changed, rerouted in your mind. Yes. So scientists have done that, and they've used visualizations to cure physical illnesses. Chronic pain has been relieved in an individual by just doing a visualization process for like 6 to 7, 8 weeks. Of course, it takes time and determination and your dedication into it. But yes, there was this case where an individual had chronic spine pain injury. So her back pain injury, it was there for years. It was chronic pain, and there's nothing, no medicines, nothing helped her, nothing. There was no solution any doctor found, because it was like chronic pain. It was only temporarily. She could take a painkiller and that was it. But she worked with a neuroplastician, that is one of the individuals who worked with rewiring the mind and the property of neuroplasticity with visualizations for continuous 6 to 7, 8 weeks. And the pain was gone. So it's possible, but only your belief in it and your work in yourself and constantly telling yourself that I can and believing in that will help you to rewire that mind and program.
Okay, great. What is the name of the book you just mentioned?
So there are 2 books by Norman Duich. One is Brain's Way of Healing and The Brain That Changes Itself. Both of them are brilliant books on the line. And there's another one which works along the line of belief system, as I mentioned, is called The Biology of Belief. I just told you a little bit about the belief system here, but it is very elaborately, a little along the science line. So more biology and things are considered in it. But The Biology of Belief talks about this biologist who iterates properly how changes happen in the cellular level with environmental signals that are observed, and shows that, the cell always works for survival. If you look at amoeba, like unicellular organisms, any organisms, right? They always work for survival. So in an environment, if, for example, there's scarcity of water, so it will try to conserve the water which is within, right? So now the normal mechanism of this cell has changed. It will adapt to it, right? So similarly, if the environmental signals are toxic, your cell can adapt to that situation to be able to be comfortable in that situation accordingly. This is how a lot of scientists have learned that the genes mutate. If a cell is in an environment which is not favorable and, seen that it is not getting all the nourishment it needs, so it will mutate. The normal mechanism will change because it needs to adapt to this situation now. And that change is not the normal cell which is there, how a normal cell works. And that somewhere triggers the genes which causes the cancer or various illness and elicits illness eventually in chronic stages. Yes. So these books are immense knowledge that you will get about, these belief system and how these things affect you. And it can change your perspective absolutely about the healing process.
Right. And we say that meditation and some of the emotional, mental wellness practices, it helps in recovery.
Absolutely.
And we often get this question that how does exactly it happens, how meditation heals your body.
Thank you for asking that. So I love talking about meditation because I've seen such beautiful benefits of meditation in people. So one of the first misconceptions, because when people go into meditation, they have a big misconception that, I have to sit and work on the thoughts, or I'll always get thoughts in my mind when I sit to meditate, right? So I can't meditate. Right? A lot of the time this happens. This is the reason a lot of people don't continue meditating, because when they sit by themselves, a lot of thoughts come up, surface, because these are the thoughts that we've been maybe suppressing and they surface during meditation. Now, during this time, what I observe in a lot of my clients, they say the same. I tell them to just maybe reframe those thoughts at that moment or just observe it. But the benefits now, how does it benefit when you meditate? Like, for example, this is you. Okay, this is you, and meditation is a process to connect to your inner source, right? To your inner you, to your inner, whatever, blissful state, whatever you may call it. That is a simple, if people ask what is meditation is about is about connecting to the inner you. Yes. Now, when you try to connect to your inner you, with time, we have got so many limiting beliefs about us, so many conflicted beliefs about us. When you try to connect to your inner you, those are the things which are going to come up. first. And that's the reason all these wandering thoughts and negative thoughts come up normally when you sit to meditate. So how meditation helps you is your meditation is actually helping you getting awareness about this negative thought that you have, these negative beliefs, these blocks and walls that you've created against your real you, which you have, which are coming up. So in this process, if you do have, for example, if any of you all are practicing meditation and you feel like this thought keeps coming up, every time I sit to meditate and this thought keeps coming up, be aware now that this is something which is blocking you, right? And now the action bit, now that you're aware, the important part is action on it. That is where the change happens. Most of the times we sit with the awareness like, okay, now I know this is the block within me, but what do I do about it? I don't know. Okay, if you don't know, of course you can ask for help for it. But if you don't know, then you can take action to it, because that's where the change happens. Now, when you've worked on this block, this layer of you, which has been blocking you, will open up. And now you're getting more closer to your inner self. What happens in this process? Your inner resources are getting more strengthened. At the same time, you're getting more and more comfortable being with yourself in that moment now. And you're training your mind to come back to you in that moment every time you sit to meditate. We're not used to doing that. We're always used to going back to the past and future. I think I lost her, but I hope everything's good.
I'm just putting in charge.
No problem. Yes. So whenever you sit to meditate, what we're doing is we're training our mind to be more in the present, which we're not used to doing. We're always thinking about the future. We're always thinking about the past. But when we train our mind to be in the present, we are finally accessing all of the energy that we have in our life. Because if you think about it, all the energy you have in your life is always only in the present moment. Right? The energy that I have in my body right now, it's only in this present moment. This life that I have is not there in my future. It's not there in the past. The life that I have, the energy that I have in me is only in this present moment. And the more you tend to tend to train yourself to be in this present, the more you tend to allow yourself to be in that lively moment of yours. And that is like happiness to yourselves, because you're energizing yourself, you're recharging yourselves at that point of time. But when you're taking your mind to the past and the future, we're going through hustle or we're going through something negative and losing out this energy that we have here. So if you ask anyone, if whenever you sit to think about past and future, you feel drained. What is the reason? Because you're not accessing the energy that you have here. But when you learn to meditate and train your mind to be here, you get more and more comfortable with yourself as one, because you learn to understand your negative thoughts and work on it. Second is we train our minds to be in the present moment, be more mindful in this moment. And third is you're actually accessing your energy now and vibrating in that energy more, which to your cells is like recharge, right? So it has beautiful effects on you as a healthy individual, or even anyone who is dealing with any kind of illness, because you're giving it more charge and energy to heal. It's like positive energy that you're giving to it all the time.
Okay, that's really beautiful explanation in a very simple language how
Thank you.
it can work. Yeah, I've seen wonderful, you can say, results of meditation, and it's really good, simple, easy to do, but then yet it is difficult to do.
Yes. So meditation is not it's not a one-time thing. It's actually a practice. So like yoga, right? When you talk about yoga is a practice. Meditation is a practice. There's a reason it's called a practice, because you're actually practicing to do it now. When the first time you do it, you might not be able to do it the right way. But even if you sit for 5 seconds, and that's what I always tell my clients, is like, you know what? It's okay. First few times, if you sit and you're not able to concentrate for more than 5 to 10 seconds, it's all right. Keep doing it. Keep doing it consistently till you are able to. It will increase with time only. That is how it is. But everyone goes into meditation thinking that, you know what, I need to be able to sit 5-10 minutes like this. And that's when they get demotivated to do more about it.
Right. So, Dr. Vidhya, you also practice hypnotherapy.
Yes.
Yeah, I've heard about it. And so I've been, doing research on many of the modalities of healing, or you can say complementary and alternative therapy for cancer patients. And hypnotherapy is a therapy on which I'm yet to come to a conclusion. So it's good that we are having this session today on the same. So, and I've been, many patients ask me about this. So, but still, there is more research to do in this space, I believe. So can you please throw some light on this and how it helps cancer patients?
Sure. So in the process of healing, if I'm talking about just about physical illnesses for now, because there's a lot of things I can tell you about it, and right, but I can just tell you basically how we use the tools of hypnotherapy. So how I also came about it in my journey as well. So when I started studying the mind and I started studying the power of the mind, we all understand the importance of the subconscious mind here. The subconscious mind is where all of these memories and experiences, our programming, our belief system, our identity, everything is stored, right? And it's also what controls us 90% of the times. It is also where your programming of your body, of you, has been stored, is the subconscious mind. So now how do we access that? For example, if I have a limiting belief, if I have an unhealthy programming which is affecting me mentally or physically, right? Because it does show, anything mentally shows physically as well, right? And if it is coming from somewhere deep-rooted, and normally most of our illnesses is coming from deep-rooted causes and beliefs, right? How do I access that? And hypnotherapy, hypnosis, is a way of accessing your subconscious mind. And through hypnotherapy now, I can help an individual, facilitate an individual of accessing your deep-rooted causes of anything. So in case of cancer patients, what I have observed is the emotional source now, most of the time, in case of cancer patients, is there's maybe a lot of resentment in an individual, maybe a lot of anger, maybe a lot of suppressed sadness, maybe a lot of conflict within, right? The patterns that I have seen. But most commonly what I've seen is anger and resentment. A lot of suppressed emotion, which shows that anger eventually, but there's a lot of unexpressed emotions people have stored and been there for a very long time and this comes from childhood, not just like adulthood, right? Like long-term suppression of emotions, which is stored in the mind. And so if you look at it in the form of cellular level, it is unhappy cells, like a lot of angry and unhappy cells. Now, how do angry cells look? They are red and inflamed, right? Now, if you think about it, if cells are inflamed for a very long time, they will become diseased, isn't it? Right? So that's what happens at a cellular level when there's a lot of emotional energy which has been suppressed within you. It does show somewhere in your body, and the cells get inflamed or diseased eventually. Now, if there is an emotional source where all of this suppression has happened, right? Normally there is, which I have observed in clients. I have seen in a lot of clients where individuals have a lot of anger towards their parents, a lot of unresolved trauma, unresolved emotions, and most of these unresolved trauma and emotions are stored there. I help access that and help them let go of that from that level. Because at that level, even you develop a belief about yourself. Right? For example, I can give you, if a child has gone through an unhealthy relationship with his father, yes, and has never received love from his father, and his father's maybe physically and mentally abused him, right? Now, there's a lot of emotions as a child, that child went through and was not able to express, right? Maybe which turned into anger and a lot of other things, and wanted to question the father, a lot of things. And this is a true case that I'm talking about. So all of those emotions were always stored with that child, never been able to express it, never been able to express to anyone, being an only child, right? So it's always stored there. Now, at that space also, that child also believed that maybe my father doesn't love me. And that is the reason that he doesn't talk to me. That is the reason he doesn't give me attention. That is the reason that he beats me up or whatever. So there and then now he has a belief about himself as well. Starts questioning himself or looking at himself from a different perspective. And let me tell you, first 7 years of your life is where you develop the concept of self as well. So now there is a concept of self developed there, and a very strong accusation towards self as well. Now, in a hypnotherapy level, at a hypnosis level, we do an inner child work here, and I help the individual to have a compassionate conversation at a subconscious level with the child and let go of all the emotions, maybe, which is anger or whatever that is, that child wanted to express. At the same time, change that programming that child had at that instance. So if that child felt that his father didn't love him, or he's not lovable, or he doesn't deserve love and compassion, or if that child felt like he's not worthy or worthless, change that at a subconscious level by, involving the conscious mind, of course, consciously involving that mind and telling that inner child that, you're worthy, you're happy, you're enough. And it's a beautiful experience at a subconscious level when I see this happening. And that inner child, that part of you, is finally feel relieved because someone has, just given that compassion and love that part of you has been waiting for. And that causes a shift, because if you imagine it again, that is an unhappy part of you. It is a part of you which is unhappy, and it's been there for so long in your subconscious. And now it's finally let go of. And that emotional charge has been released and filled with a healthy, happy space and positive space. And now the cells are happy again because they've received the nourishment, as I mentioned about the cellular level, right? If it receives nourishment, it thrives. If it doesn't, it adapts to that situation and becomes unhappy or diseased or whatever, right? And now it's reached a happy space. And this changes the subconscious level of your, how you look at yourself as well. How that individual look at himself also changes at this aspect of even future situations. Because that part of you which felt that he was not loved or deserved or worthless now doesn't feel that way. And this is a very experiential process, of course. I'm just giving you an idea of how it goes about, but it's only when you experience it where you understand how this goes. But yes, at a subconscious level, this is possible. To let go of past trauma, to reprogram that past trauma, to reprogram beliefs. Right? That's the only way, actually, through hypnosis or repetition. 2 ways of reprogramming your mind is through hypnosis or repetition. And if you know, first 7 years of our life as a child, the child's brain waves, that is our brain waves, works at theta level that is low vibration. So it is in a receptive state. First 7 years of a child is in a receptive state. So everything that he sees or learns, he receives and stores. And hypnosis is in the same state. In hypnosis, your brain waves are always in a theta state. It is a state of reception. So it is very easily possible to reprogram at that state again, whatever that child learned at that level. And that's how it helps in a very long phase of mental or physical well-being of an individual.
Okay. Wonderful. Yeah. Okay. Thanks for sharing that.
My absolute pleasure. I have seen the benefits in myself and during this, because when I learned hypnosis from my mentor, I actually had just gone with the purpose of learning it. Being a doctor, I was like, I'll just do the research and, and study it and go. But I understood that, there's a lot of reprogramming needed in me when I went into the process. And I went through the process myself, of course. I went to my mentor and I was like, by the end of the whole course, I was like, no, I need a lot of reprogramming myself, a lot of beliefs that I have, which have limited me, which needs to change, because I want to be a free space. I want my mind to be a free space and not a limited space. I want my cells to thrive rather than to be in a succumbed state, right? So a lot of change was needed to be done, of course, on myself as well, to be able to come in this line of work. Yes.
Right. So coming back to cancer, there's a phase comes in the journey where yes, I mean, before that, when doctor told you 6 months, and yes, nobody wants to believe that. And that's actually not true. It's not true in all the cases. So yes, it's okay if you don't believe it, but because nobody can say how much time. And I've been hearing this a lot of times in last few days. Dr. Nessa, yesterday somebody messaged me that I will die along with my wife. And I was like, I mean, the whichever way I handle that situation. But before talking to me, the person messaged me that you also don't say that she has 6 months to live. I was like, I don't believe in that. So why would I tell you that? And then I explained him that, what is 6 months and why it's not always true, and the median and the survival and everything else as well. And then I also explained him that, okay, if you want to connect to 4th-stage survivors, I can connect you. But anyway, so when that phase comes when doctor tells you 6 months, and then yes, most of people don't believe in it, but still because they heard from the doctor, it's somewhere in their subconscious mind. And then on one side they don't want to believe it, on the second side they know it. So why did even the doctor tell you that? And now it's really difficult to be in that situation. now, and then you try everything and anything possible in this world to save that person. You try all the healing techniques, and yes, many people have recovered from it. So I believe that till the time the person is breathing, there is always a hope, and let's work towards that. So that's what I tell to all my patients. And now phase comes when you see that you're losing the your loved one. So and it's I mean, it doesn't, it's not necessarily with cancer, but with any other chronic illness or with age also. It can be the death, could be due to any other factor as well. So now when we talk about cancer, and when you know that you are losing your patient, maybe in a few weeks or in a few days time, and that's a phase, maybe we can call end of life care. So but not everybody is able to have that discussion, because they haven't accepted it first, and it's okay that you have not accepted that it's end of life, because yes, we always have hope, so it's okay not to accept that he's going to die in few weeks. But then also that it can happen, but you don't want to think about it, because you believe that if you think about it, then the power of attraction, it might happen. So then you want to avoid that altogether. I did the same, that I never talked about it, never thought about the people who talked about it. I never talked to them again in my life. So now, but then when he passed away, I think that that I wish I had those discussions with him, so that I could I could know how he wanted to die, or how he wanted to spend the list of like few days or few weeks, like that. So but then so this is end of life conversation I'm talking about. So nobody wants to do it with their loved ones, but then you feel that somewhere it's needed. So how can we manage the situations?
Well, Dimple, in this situation, I think it should be left, this choice needs to be left to the individual itself, right? To choose whether they want to accept it or whether they don't want to accept it as well, because each person has a choice to do that. But at the same time, if you're a caregiver and if you know that one of my loved one is maybe going to die in the next few weeks or months, right? And understand that maybe I should talk about it. Maybe because if you think about it, as you said, I thought that I should have spoken to him. Maybe I should have asked him how he wants to die. But that's you talking.
Yeah. I mean, in real life, we can't do that.
Yes, because that's you talking, because you thought that you should give him some more. You had that connection, you had that compassion for him, and it's out of your space of compassion. I absolutely understand that. Yes, right. Of course, as a caregiver, we want to make it as beautiful as possible for them, make it as wonderful as possible for them, and make sure that maybe in the last few days be beautiful and good and like happy for them as much as we can do for them, right? But at the same time, it's their choice. We need to give them that space of choice to and this understand if they want to accept that, or if they want to, how they want to live with it. That being said, you can still make the last few days beautiful from your side without verbal communication, but just non-verbal communications, right? Make it beautiful for both of you, so that you feel complete and they feel complete, right? Because what happens is when you connect with an individual, there is an emotional attachment. And as a caregiver, you have a lot of emotional attachment to that individual. There's a lot of love and compassion that you have both given to each other. And there is an attachment. Now, why we feel so uncomfortable once they have gone is maybe we feel like it was incomplete. Maybe I didn't complete it properly, right? Maybe I should have done something else, or he should, or we should have done something. So we can always choose from our end how you would like to complete it, but you cannot choose for them. Yes, that's a choice they need to make, how they would like to look at the end. If they would like to accept it, or if they would like to go fighting and be like that, I fought till the end. That's again a choice we would have to leave up to them and respect it, right? However it may be. I know for us it might be difficult, but it is their choice in the end. Yes.
True. Yeah. But sometimes it happens when So I have experienced it, and some of other caregivers also. So I never had end of life conversations, because if I talk about death to him, he might think that Dimple has given up. Dimple has no hope, and that is why she's talking about end of life. While she has been the strong pillar, rock solid pillar for me, taking all the decisions on my behalf all this time, and now she's talking about death, it means that yes, I am dying. So all this while he has not accepted this, that he is dying, but now he might think, because one of his important caregiver is saying that okay, she's talking about death. Now I never talked about it, because I thought that if I talk to him about death, even if he's not thinking about it, coming from the caregiver, he might start thinking about it, and because of that the power of attraction might work, and he might die early. So that was a circle we were, well, he knew what's coming, I knew what's coming, but we were not accepting it. So yeah,
Absolutely. So that's what. So we think that they're not thinking about it, but if
they
you
are
think
thinking about it, right?
exactly. Honestly, if you don't think about it, they are thinking about it too. Of course, how can they not? It's just that, and he might be thinking the same. Maybe like what if I talk about it, Dimple will give up. Maybe.
Yeah, right.
Right? So now, if you have, if you would have also spoken about it or not spoken about it, that we might not know how it would go, how it would not go. We cannot talk about that, of course. But then again, if that person has chosen to keep you also in a safe space and they thought about your emotions and decided not to talk about it, well, maybe that was their choice, isn't it?
Yeah, that was his choice.
Right? So you need to just respect that and be like, okay, I understand. And if you feel for yourself, if you feel like you've had an incompletion and if you feel like you wanted to say something, you can still do it, but not to do, I mean, you don't have to do it personally to him, but you can maybe write a letter and write it down somewhere, because there is a space of you which wanted to express, which I feel like right now as I talk to you, right? And if you don't suppress it, maybe take a piece of paper and let it out somewhere, and you will feel complete. And trust me, how as I spoke about the whole system, we're all one in the end. If you want to send out a message, it will reach them, right? So you can just maybe write it on a piece of paper and it will reach where it's supposed to reach. So, and that will make you feel complete with him.
Right. Thank you. Yeah. There is a question. When can a person use healed? I am healed now for themselves. How can one know if he or she is healed?
Yes. So to use the term healed, if I had to say so, I recently read this term. And so heal, if we talk about it, is not just like in the old English, it was called healen. Healen, I don't know how it's pronounced, but it was not only to mean to cure, it means to make whole. Right? To make whole means to make to be complete. Right? So in the process of healing, be it physical or mental health illnesses, if you reach a space where you feel like yourself again, if you reach a space where you feel like you are content with yourself, if you reach a space that you feel like your mind and body is in this moment and happy with it and content with it, with the change that has brought about, whatever has happened, and reach a space where you feel it's a better space to be, you are healed. You're whole again. You're complete with yourself again, right? And it does not have to mean that because healing is a term used for it's when you talk about healing, it's actually in our mind. Yes, the healing process starts with that in our mind. And if I'm diagnosed with cancer, for example, and if I tell myself a couple of years I took treatment and everything, but in my mind the cancer is more stronger than in my body. If you think about it, if you think about any healing journey, it's in the mind, which is much more tormenting rather than what's going on in your body, because you can't see it in your body, but in your mind it's there, right? But when you start getting comfortable with it, or even understanding and accepting yourself and understanding that I am complete now, I've learned this, I've done that, and now I've reached a space, okay, this is it, I'm comfortable with this right now, and reach a space where you understand I am here, I am in this moment, I'm content with it, I am healed.
Okay.
Yes.
Got it. There's another question. Does being conscious about our negative thoughts help us manage our mental and emotional health as well? So there's another stress with people, because everybody says that be positive, but then the situation in which we are right now, we cannot be positive all the time. And even if the negative thoughts comes in, that's more stressful, because, oh my God, that person told me to be positive, but I am not being positive right now. I'm being negative, and that is causing more stress to me. So how do one handle such situation?
Yes. So being conscious about a negative thought helps in a way if you take action about it. So what happens is we have a few thoughts which are automatic. Some of our negative thoughts are very automatic. Something happens, a negative thought comes up. Something happens, a negative thought comes up. So now, if there is a negative thought within you and you have learned that this is coming up again and again, you either act on it, right? If possible, if you can act on it, do something about it, take action. Because sometimes we just accept it. And now acceptance can be in two ways. It can either be helplessly, that, this is my negative thought. And the other one can be with responsibility, saying, okay, this is my negative thought. What can I do to change it? Right? Instead of pressurizing yourself and be like, how can I get a negative thought? That's normal. We all can have negative thoughts from the way we've been conditioned and experienced in our life. It's possible to have negative thoughts come in our way. We cannot be always positive. But when you get a negative thought, observe it and ask yourself, what do you want to do with it? Right? Do you want to keep it? Do you want to act on it? What do you want to do with it? Instead of pressurizing yourself, there's this thing called toxic positivity, right? You can't be positive all the time. Right? It's okay if a negative thought comes up. If you want to do something about it, then yes, work on it. But if you don't want to do anything about it, you want to sit with it, then it's going to come up again and again. And if it's coming up again and again, it's better to work on it and act on it so that it changes permanently and it never comes up again. Right? And that's going to help you, because, in fact, it's going to change a lot of things for you as a person and an individual when you look at life as well.
Great. Yes. Thank you.
You're welcome.
Yeah. If anybody has any question, Anju auntie, आपको कुछ पूछना है?
Hello, Anju auntie.
Hello. आपको कुछ क्वेश्चन है?
हाँ, मैं काफी लेट जुड़ी।
अच्छा।
बट हीलिंग में मेरा पूरा विश्वास है। कई बार मेरे को रात को नींद नहीं आती, तो मैं बस के पूरे ब्रह्मांड की पॉजिटिव एनर्जी, प्लीज अंजू चौहान को हील करो, और 10 मिनट में नींद आ जाती है।
बढ़िया। Absolutely, yes. You can access ब्रह्मांड की जो एनर्जी होती है, हम कभी भी एक्सेस कर सकते हैं, क्योंकि हमारे अंदर भी वो एनर्जी है, तो हम कभी भी उसको एक्सेस करके अपने अंदर रिचार्ज कर सकते हैं अपने आप को.
Right. Yes. There is a question, although we know we are in a bad state, how do I accept change? Sometimes I experience it in terms of frustration, anger expression, and then post the incident, I feel like that just wasn't me. And how did I do it? What do I do in those terms?
Yes, I understand. When we understand it in a bad state, and a lot of emotions might come up, and as you mentioned, in anger, frustration, and all of these things. And after a few minutes, you might be like, that wasn't me, or I shouldn't have reacted that way. Instead of looking at it from this perspective of that wasn't me, or how did I do it, or questioning that behavior, just observe it and maybe ask yourself, okay, something inside of me led to this expression. I don't know what it is, yes, but there is something inside of me which is feeling this. So address it, because it doesn't come out of nowhere. You might not know where it's coming from. I agree. You might not know where it's coming from. But if you just accept it, yes, this came out of me, and try to understand, okay, there's something inside of me where this is coming about from, then there's more clarity that you will get, and you might be able to maybe look at it from a perspective of understanding yourself better, rather than, because when you ask yourself, how did I do it? What did I do it? Or why did I do it? You're being harsh on yourself. So, a part of you is angry and frustrated with things. So now if you ask that part of you, why did you do it, or how did you do it? That part of you is not going to reply. That part of you is not going to tell you. And that part of you is going to get more angry. Like, why are you questioning me? Right? So instead, just be like, okay, I understand now. A part of me is angry. A part of me is frustrated. I don't know where it's coming from, but I understand it is. And maybe with time, when you start being more understanding towards your emotions, you'll start understanding where it's coming from as well. But if you're not understanding, and if you tell yourself why you shouldn't have, you couldn't have, and all of these things, it will just increase the same anger and frustration more and more.
So he's asking exactly, is it a spirit or can it be a spirit?
All right. So, whoever this asks this question, is it a spirit? No. I would like to answer. You yourself have a spirit inside of you, right? If we talk about yourself, we have a soul inside of us, and it is a part of this you which is angry and frustrated. And this part of you maybe is angry and frustrated because you have suppressed it for a very long time, and you're not looking at it and acknowledging it as well. And that is the reason you feel like it's not a part of you, because you've suppressed it so long. Right. And now also when you ask the question, you keep asking, how did I do it? Why did I do it? There is a part of you which has been maybe suppressed for a very long time that you have not addressed. And now it's showing in anger and frustration, because long-term suppression leads to anger most of the time. Long-term suppression and repression leads to anger and frustration. So if you don't understand by yourself, that's okay. You can obviously ask for professional help for that. Yes. And if you do, express to get help, you might get deeper understanding of where it's coming from, and then you can work on it. But be more understanding towards it rather than judging it and being harsh on that part of you.
Okay, thank you.
Most welcome.
Mehul, do you have any questions? Would you like to share anything? Anything you felt, similar experiences?
Yeah, thank you, Dr. Vidya, for such a nice conversation and session. And I do relate to a lot of things that you were saying. I'm a stage 4 cancer. I was given a month to survive. 7 years now.
Wonderful.
Thank you. So the first thing, like the power of attraction, like Dimple knows well, I keep talking about it all the time. So I did not believe in all those things before, but then I started feeling it. Like while I was in treatment, I kept reading books on people who survived cancer and how they worked on it. And then that made me think, yeah, and I did practice it.
Yes.
I did feel, okay, I'm thinking of this. Although I don't get everything of that, at least I'm somewhere close to it. And then I started telling people about my experience. Then they came up with, yeah, we feel the same. And then it really works for us. Like, yeah. So that definitely works. At least it makes you feel good.
Absolutely. It works.
And I do believe the mind is the most powerful thing in your human life, because no offense to doctors, but when I speak to people who are in negative thoughts and they say the doctor said this and that, so I tell them, see, doctor is a human being, he's not God. So he's going to ask you 10 questions. Where is your pet dukh raha, sar dukh raha, chakkar aa raha, he's going to ask you questions, and he's going to see which algorithm fits your body. And then he's going to prescribe those medicines. Okay, this algorithm, this is the derivation. So I kind of make them feel good. Like, yaar, wo bhi puchta, so it is your mind. Mujhe nahi dard ho raha, yaar, I'm feeling good. So that really helps a lot. But yeah, when I was in treatment, I was here in the US, but I was treated in James Cancer in Columbus. So there were people, they were healers who used to come in the hospital, which I didn't see in India.
Right.
But I was confused, like, why are these people here? Like, I'm not dying. And they used to come and hypothecate and all those things.
Right.
It was new to me, but now I relate. Yeah, it's really good. It changes your state of mind. Absolutely. And that's it's along with the medicine, it really helps. So like Dimple does the healing sessions. It's morning for me here, Sunday morning, but I make sure I wake up and I'm here to listen. It makes me feel good somehow, and it energizes me. So definitely we need people like you and sessions like Dimple does every two, to rejuvenate yourself and get energized. And okay, now
absolutely beautiful. Thank you so much for sharing your experience.
You're welcome. Thanks both of you.
It's lovely to hear from you. And absolutely, as you mentioned, right, in the law of attraction, the more you do it, the more stronger it gets. And something, as you mentioned about doctors, right, it's true. So you know what, with time, if you look back very, very long back, and if you actually go back into studying how science developed, Hippocrates and all these olden healers actually depended on the body's intelligence for healing first, right? Back then, it was only on the body's intelligence that everything was developed. But with time, of course, a lot of, we started using nature to, how do I put it, to own nature in our capacity, right? Humans try to own nature in our capacity. So we started developing things which we can take control of. So for example, if we understood something in our body needs this, we started to make medicines for it more and more, because this human's greedy mechanism developed that, right? If we need this more, we'll make this more, make that more. And what happened is now with time, that is how maybe it started. We started depending on that more than our own inner resource. So for example, we need small elements like calcium, magnesium, sodium, potassium, all of that is already in our body. When we understood this, now we started telling people, okay, this is good for us. So what happened? People started making calcium supplements, magnesium, vitamins, and all of these things outside from the body, right? Whereas we actually get it from our food and nourishment. Now, when this started developing, now what people do, they don't eat nutritious food. They have vitamin supplements instead of having nutritious food.
Exactly,
right? So what happened in this process is now the body's intelligence reduced. The body's awareness and intelligence reduced. Because this is the programming now which has been sent forward from back in the days to now. Now the programming which has been passed forward to a generation is that our body needs something else to heal, to be nourished, and to be supported. Right?
Yeah, even...
yes.
Sorry, go ahead.
Yes. No, go ahead. Please do share.
Yeah, even like you were talking about the state of mind, subconscious. So I just saw a movie recently, Inception. I don't know if you've seen that.
Yes.
So it makes you go in a different world altogether. Like, man, you can create a duplicate self of yourself. You can go in a different world and I'm like, if this is possible, like that would be so great.
Absolutely.
But I was thinking of that movie when you were talking about the subconscious mind and
something like that. When we go to the inner child world, you feel like you're in a different space, but it's that we are accessing. Yes, that's the thing, right? So, and that is what we can reprogram. So, in the beginning, I don't know if you've heard when Dimple mentioned my way of healing, it is deconditioning first and then reconditioning, right? Because we have been conditioned with a lot of limiting beliefs. So we have to first break free from that to inculcate back the actual natural healthy beliefs which have always been there within us, right? But we never accessed and never encouraged and strengthened, right? So that is the process I bring about. And if an individual actually tries to tap into our own inner resources, we don't need anything else for our survival, because God made us with everything we need in our body to deal with situations and things in our life.
Agree, yeah.
Yes.
Great. Wonderful session, very informative, and most of us could relate to what you shared today because जो हम experiences share कर रहे थे एक दूसरे के साथ में, and हमें लगा कि हाँ ऐसा कुछ मेरे साथ में भी हुआ है. Yes, मेरे साथ ये अभी भी हुआ था. So when we talk about healing or mind or emotions or things like this, most of us go through the same things in this cancer journey especially. And it's just that phases are different. For me, it happened in first month. Somebody, it will happen in fourth month, like that. But then we all go through the similar phases in this journey. And what brings us all together is that journey and the common purpose, common cause for which we all are here. And that's what motivates me to do it every Sunday with all of you. And Mehul, पता है कभी मुझे लगता है कि कौन सा Sunday break लूँ. Honestly बोल रही हूँ, कभी लगता है कौन सा संडे ब्रेक लूँ, फिर लगता है नहीं.
उसमें प्रॉब्लम क्या होता है कि सैटरडे इवनिंग is usually my time. So if I'm partying or something, then I have to think, अरे कल उठना है सुबह जाना बस कल. This should be not told in this session, but but then I enjoy this more than any other thing. Like I kind of I meet to I get to meet people like Dr. Vidhya and so many people who join the session, and I open up my world. Even if this, I tell you, what, this I'm working from home. I've not been from March. It's work at home, so it's a blessing in disguise. If I would be going to office, I would be in office at this time, and I would be not able to meet and do all the things I'm able to do now. So there is a positive side in every negative side, is what I learned.
Agreed.
Every coin has two sides. So negative में positive क्या ये ढूंढो तो you will start ignoring the negative part. Like cancer. People ask me, yaar, cancer ho gaya tha. I said, man, you know me because I had cancer, right? Cancer made me famous. It's a blessing for me. It's not I'm very happy it happened to me. I've changed now. I've been a very different person. My life after cancer is the best life. I tell you. So I have no regrets.
And I give your example to many patients, Mehul, कि जब वो recover हो सकते हैं तो आप भी हो सकते हैं. And there's always a hope. And I give so many people example कि अरे fourth stage है तो क्या हो गया, ठीक तो हो सकते हो ना फिर भी. And I tell them कि कभी भी मैं आपको connect करवाऊंगी जब भी आपको करना है, but then it is very much possible. So yeah, and what the takeaway for me from today's session is that we can heal ourselves, and it's our thoughts, our subconscious mind, and it's we who is running our own life around us, whichever way we want to do it. So कल मैंने उनको exactly यही बोला जिस patient से मेरी रात को बात चल रही थी. He said that I will die with my wife in 6 months, and I was like कि नहीं, आप खुद भी stress ले रहे हो, negative बोल रहे हो और उनको भी negative कर रहे हो. So अभी वो करते हैं जो कर सकते हैं. And then I gave a plan to him and कि okay पहले ये फिर ये फिर ये फिर ये ऐसे करेंगे. आपके पास टाइम ही नहीं बचेगा ये सब सोचने का. राइट नाउ यू डोंट हैव अ प्लान, यू आर लॉस्ट, एंड दैट इज व्हाई यू आर टॉकिंग अबाउट नेगेटिव थिंग्स. सो लेट्स टेक वन स्टेप एट अ टाइम एंड देन फर्स्ट गेट दिस एंटी कैंसर लाइफस्टाइल चेंजेस. मैंने उनको डॉक्यूमेंट दिया, ओके आपको एक अच्छे डॉक्टर से मिलवाते हैं मंडे को, फिर ये करते हैं फिर ये करते हैं, आपका ये एडवांस टेस्ट हो सकता है, इम्यूनोथेरेपी हो सकती है, इम्यूनोथेरेपी से लोग ठीक होते हैं. तो द एंटायर थिंग ही वाज लाइक थैंक यू सो मच मैडम, थैंक यू सो मच. लाइक ओके जैसा आप सोचोगे वैसा होगा. सो फर्स्ट रिमूव कर दो इस लाइन को अपनी, पहले तो जो भी आपका पूरा प्लान है, बिकॉज द वाइफ इज वेरी यंग, जस्ट 38 years old, and then has kids also. So for him it's a big shock. So yes, with our thoughts we can change our life the way you want to lead it. And I very much believe in the power of attraction, the power of subconscious mind. And once again today what you talked, I could relate to it, we all could relate to it. So thank you so much for the sharings, learnings and your experiences. Yeah, and thank you for taking your time out to share your
I think Anju ma'am wants to talk something. I think she's raising her hand.
Yeah.
मेहुल जी ने कहा कि आफ्टर कैंसर मेरी लाइफ बेटर हुई है, तो वास्तव में मेरी भी लाइफ बहुत कूल, पीसफुल और एंजॉय करते हुए जीना. और मतलब अब बस ये है रोज का जीना है, ज्यादा सोचना नहीं है. तो बहुत चेंज हुआ है, बहुत चेंज.
देने का.
हाँ जी,
टेंशन लेने का नहीं, देने का.
हाँ देने का, बस
देने का लेने का नहीं.
नहीं, अब टेंशन होती नहीं है, अब हो गई जितनी टेंशन होनी थी हो गई, अब कोई टेंशन नहीं होती.
बहुत अच्छा लगा सुन के. Thank you so much for sharing that. Thank you both of you all, Anju ma'am and Mehul, for sharing that. And yes, thank you all. Thank you for having me. It was beautiful to be here. I'm so happy I could share my knowledge with all of you. I hope even thoda sa bhi, if anyone has had an effect with my words and somewhere a mind shift has happened, it would be beneficial for each and every one, I believe. And it's what you're doing here, Dimple. I would like to really appreciate you for doing this. It's a beautiful space that you have built here, having people around here and supporting them and giving them the love and compassion that they need. You're a beautiful soul. I can see that. And I really wish you all the best. And all of you who are here, wishing you all the best. A lot of love, light, and belief in yourself. If you do, you can just see overcome everything. There's nothing stopping any one of us but us. Always. Nothing else stopping us but us. So believe in yourself and don't believe in anything else more than yourself, right? So believe more in yourself than anything else.
This is the example of the power of attraction.
Yes, absolutely. Yes, it is. That's what I said, Dimple, right? I've always been wanting to do something like this, connect with people, and it just came to me. I'm telling you, it always works in wonders.
Yeah.
And, everything happens for a reason. Trust me, everything happens for a reason. जैसे मेहुल जी ने और अंजू मैम ने बोला कि मेरी लाइफ कैंसर के बाद बहुत ब्यूटीफुल हो गई है. So think about it. Maybe it was for a reason कि life live करे in every day and every moment, right? So that's wonderful to hear.
Yeah, great. So thank you everyone for joining us in
Thank
today's
you.
Circle Talks. Thank you, Shakti, for sharing your experience, and Anju, Auntie.
Yes.
Thanks to Dr. Vidya and everyone else, Poonam Auntie, and all of you make this circle more beautiful, more sacred, and more open to share with each other. And looking forward to the next Sunday as usual.
Yeah.
If anyone wants to contact me, I can put in my email here. If anyone has any help they need, feel free to contact me. One second, I'm just going to put my email here.
Yeah.
Because if I missed out anything and if you need more clarification on that, you can feel free to send me an email on this. Yes?
Yeah, got it. Thank you so much. And
Most
thank
welcome. Take care. Yes.
Bye.
Bye-bye.
God bless you.
you.
Bless all. Thank you.
Thank you. Thank you, Dimple.
Thank you, Poonam
Thank you.
Auntie.
Thank you, Dimple ji.
Thank you, everyone.